Hashimoto's disease, also called Hashimoto's thyroiditis, is an autoimmune condition where your immune system mistakenly attacks your thyroid gland. The thyroid gland is a small butterfly-shaped organ in your neck that produces hormones controlling many of your body's essential functions, including metabolism, heart rate, body temperature, and energy levels. In Hashimoto's disease, your immune system gets confused and starts attacking your thyroid gland as if it was an enemy. So, it starts producing antibodies that target the thyroid. When this happens, it gradually damages the gland's ability to produce its vital hormones. Over time, this leads to an underactive thyroid, known as hypothyroidism. In some cases, the inflammation may cause the thyroid to enlarge, forming a goiter, which can be visible as a swelling in the neck. Hashimoto's disease is the most common cause of hypothyroidism in developed countries, affecting approximately 5% of the population. It is particularly prevalent among women, who are up to 10 times more likely to develop the condition compared to men. Causes of Hashimoto's disease. The exact cause of Hashimoto's remains somewhat unclear, but research has identified several key factors that contribute to its development. Number 1. Genetic predisposition. If you have family members with Hashimoto's or other autoimmune conditions, your risk is higher. Certain genes make some people more susceptible to autoimmune disorders. Number 2. Environmental triggers. Various environmental factors can trigger the disease in genetically susceptible individuals. These include excessive iodine intake, radiation exposure, certain medications, and infections. Number 3. Hormonal changes. Women are much more likely to develop Hashimoto's, particularly during pregnancy and perimenopause, suggesting hormonal fluctuations play a role. Number 4. Stress. Chronic stress can affect your immune system and potentially trigger or worsen autoimmune conditions like Hashimoto's. Number 5. Other autoimmune conditions. Having another autoimmune disease, such as type 1 diabetes, rheumatoid arthritis, or lupus, increases the likelihood of developing Hashimoto's disease, as the immune system is already prone to attacking healthy tissues. Symptoms of Hashimoto's disease. The symptoms of Hashimoto's disease can be subtle and easily confused with other conditions, which often leads to delayed diagnosis. As the thyroid becomes less effective at producing hormones, the body's metabolism slows down, leading to a variety of symptoms. You might start feeling unusually tired, even after a full night's sleep. This isn't your typical end-of-day fatigue. It's a deep, persistent exhaustion that sleep doesn't seem to fix. Many people describe it as feeling like they're walking through mud or carrying a heavy weight all day. Weight gain is another common symptom, and it occurs despite not changing any eating habits. You might notice your clothes fitting differently, particularly around your midsection. This gained weight can be stubborn and difficult to lose, even with diet and exercise. Sensitivity to cold temperatures is also a hallmark of Hashimoto's disease. You might find yourself layering up when others are comfortable and feeling chilled even in mild weather. Hair and skin changes are also common here. Your skin might feel rough and flaky, while your hair might become thin and break easily. Many people also notice their nails becoming brittle. The physical changes continue as the condition progresses. Your joints and muscles might ache for no apparent reason. Some people experience swelling in their face, particularly around the eyes, and their voices might become hoarse. Women often notice changes in their menstrual cycles, with periods becoming heavier or irregular. The thyroid gland itself might even become enlarged, creating a visible swelling in the neck called a goiter. This can cause discomfort or difficulty swallowing, though not everyone with Hashimoto's develops a goiter. Other than these physical symptoms, the mental symptoms can also be particularly frustrating. Many people experience what they describe as brain fog. You might struggle to find words, forget things more easily, or have trouble concentrating on tasks that used to be simple. Depression and anxiety also often accompany Hashimoto's, ranging from mild mood changes to significant emotional challenges. You might feel unusually sad, anxious, or irritable without clear reason. Diagnosis of Hashimoto's disease. Diagnosing Hashimoto's disease typically involves several steps. Your doctor will start with a thorough physical examination and detailed discussion of your symptoms and medical history. They'll likely feel your neck to check for thyroid enlargement and ask about family history of thyroid or other autoimmune conditions. Blood tests are the cornerstone of diagnosing Hashimoto's disease. The most commonly ordered tests include: number 1, thyroid stimulating hormone, TSH. This is typically elevated in Hashimoto's. It indicates that the pituitary gland is signaling the thyroid to produce more hormones, which is a hallmark of hypothyroidism. Number 2, free T4. This test measures the level of free thyroxine, which is an active thyroid hormone. Low levels of free T4 confirm hypothyroidism. Number 3, thyroid antibodies. The presence of antibodies, such as anti-thyroid peroxidase antibodies, confirms an autoimmune attack on the thyroid and is diagnostic of Hashimoto's disease. In some cases, an ultrasound of the thyroid may be performed to assess its size, texture, and the presence of nodules or abnormalities. Ultrasound can also help distinguish between different types of thyroid disorders. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for Hashimoto's disease. Treatment for Hashimoto's disease mainly focuses on replacing the hormones your thyroid can no longer produce adequately. The most commonly prescribed medication is levothyroxine, which is a synthetic form of thyroxine. This is a pill that you need to take daily, and it provides your body with the thyroid hormones it needs, but can no longer make enough of on its own. So, in most cases, the symptoms you experience will resolve with time as thyroid hormone levels stabilize. When starting levothyroxine, it's important to take the medication consistently, ideally at the same time each day, and on an empty stomach to ensure proper absorption. Your doctor will start with a dose based on your weight and symptoms, then adjust it based on how your body responds. This usually means regular blood tests, especially in the beginning, to find the right dose for you. For the best results, it's often advised to wait at least an hour before eating breakfast and to avoid taking calcium, iron supplements, or certain antacids within 4 hours. Other than medications, diet plays a crucial role in managing Hashimoto's. Focus on anti-inflammatory foods like colorful vegetables, healthy fats, and lean proteins. Many people find relief by reducing or eliminating gluten, as it can trigger inflammation in some individuals. Pay attention to iodine intake. Too much or too little can affect thyroid function. Stress management also becomes essential with Hashimoto's. Consider incorporating meditation, deep breathing exercises, or gentle yoga into your daily routine. Getting adequate sleep is crucial. Aim for 7 to 9 hours per night. Regular exercise is also important, but start gently. Low-impact activities like walking, swimming, or yoga can help maintain energy levels without overtaxing your system. Listen to your body and gradually increase intensity as you feel stronger. In some cases, if you have a goiter or significant discomfort in the neck, your doctor may recommend additional interventions, such as surgery to remove part or all of the thyroid gland. However, this is rare and typically reserved for cases where the goiter causes difficulty swallowing or breathing. Remember that managing Hashimoto's is a journey, not a destination. What works best for you might take some time to discover, and your needs might change over time. Be patient with yourself and celebrate small improvements along the way. At the end, with proper treatment and lifestyle management, most people with Hashimoto's can lead full, active lives. Now, we want to hear from you. Have you or someone you know been diagnosed with Hashimoto's disease? What strategies or treatments have worked best for managing the symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.